Pediatric nurses provide care to all children and adolescents. This means that the child is not an adult yet. Most pediatric nurses have their 4-year Bachelor's of Science in Nursing degrees, which is their BSN, and they will take the NCLEX exam at the end of the 4 years to earn their registered nurse, or their RN. They will spend their college years taking the nursing program at their college and earning the degree, and then they'll take the NCLEX at the end of the year to get their registered nurse. They often have their Certified Nursing Assistant (CNA) certification that allows them to get experience in the medical field, and this also often allows them to get an in with the local hospitals or doctor's offices, whichever one they choose. This makes it easier to get a job afterwards. A pediatric nurse can also earn a pediatric nursing certification. This allows them to earn a higher salary and advance faster in their careers. With this certification, they will have more education and also better equipped to handle certain situations that may arise. Since patients are under the age of 18, this means that a lot of time the nurses are dealing with parents or guardians wanting to know what is happening and also having to be able to comfort them as well. Pediatric nurses deal with not only the child in pain or discomfort, but also the parents or guardians. Since they are not legally an adult yet, this means that the major focus of their time is spent calming the parents of the child while also trying to comfort the child. While children are the main focus of the visit, it's important to realize that the parents are often just as scared as to what will happen with their child. The parents will be the ones making the decisions, and it is best to give them all the options of care that can be done. If the patient wants something but the parents do not wish for it to be done, then the parents' wishes are granted. Pediatric nurses use what is called family-centered care. This is decision-making for healthcare is characterized by a partnership between patient's family and the healthcare professionals, as well as respect and dignity for the patient's cultural background, values, and beliefs. This is from exploring the influences of nursing partnerships with parents' attitudes to families' importance in nursing care and professional self-efficacy on quality of pediatric nursing care, a PATH model written by So-Yeon Yo and Huron Cho in July 2020. This shows that the child is not the only ones involved in the care and that the parents have a right to know and choose what is best for their child. It also shows that beliefs and values are taken into consideration always. If a certain religion or culture is believed, then those values are then put into play in the care of the patient, just like it would be in an adult, but this time the parent gets to tell you what it is that they want. While parents are a big factor in the care, the child is ultimately the one that matters the most, and it is important to realize that they are scared and their needs need to be taken care of. Nurses must understand that a child is most likely really nervous and scared about what is going to happen to them. This means that they must take care of their mental needs as well as their physical needs. Nurses have found that the familiarity and routines have been proven to create a more positive perception on the hospital stay of a kid. This is in nurses' perceptions of a novel health information technology, a qualitative study in the Pediatric Intensive Care Unit written for the International Journal of Human-Computer Interactions. It was written by Onar Hassan, Catherine E. Flynn, Lila Azam, and Matthew C. Scanlon in 2017. The nicer the nurse is, the better the stay is for the kid. If the nurse does not spend time with the kid and just does her job, the kid feels less safe, and if the nurse does her job and spends time with the kid, they feel safe, better equipped, and their recovery is faster. Researchers have found that the better experiences with nurses involved in the case, the better the child reacts to their treatment. A truly good nurse knows the medicine and how to take care of the people and make them comfortable in their situations.